So first of all, they need to be well educated about the potential side effects of each treatment. So some side effects are more serious, and they need to know that if that happens, they need to call the physician or the team as soon as possible. Like for example, if you are a Bruton tyrosine kinase inhibitor and you know bleeding, you need to notify your physician. If you have and I don't want to give examples. So just be aware of side effects and know that some of them are more urgent and others are not, but make sure that you are in communication with your team. These days we have a lot of options. We can, and like again, using BTK inhibitors as an example, we have now next generation BTK inhibitors that are basically better tolerated. So we can always switch treatment to one of the novel ones, or maybe even change the class to completely different type of therapy. So number one would be knowing the side effects. Number two, just knowing what to expect. Again, a lot of time, it's not uncommon for patients who just, especially we do get a lot of second opinion and consults that we get, and they just didn't know that this treatment, for example, is not supposed to be stopped. They're like, oh, I'm taking it now for a year. So give a realistic expectation to the patient on what to expect from a drug like ibrutinib or acalabrutinib or idelalisib or duvelisib if you're in the relapse setting. Also with venetoclax, just give the realistic expectation. Yes, we do give the treatment for 1 year, but I can't promise that at the end of 1 year, if I stop, you'll be in remission for years, right? It depends on how good your body or your disease, responds to the treatment. So number two would be giving realistic expectations. Number three, that kind of goes back to this principles of a doctor-patient relationship. You know, we have to come up with a plan that both are comfortable with. Some patients just feel safer to be watched a little bit more closely, and some don't. So yeah, that would go with basically some basic practice patterns and